Hi, my name is Dr. Allison Romero. I'm a doctor of physical therapy and pelvic floor specialist. Thank you so much for being here, Anal Cancer Foundation. Thank you so much for inviting me to be here. I love this whole theme, reset, tips to thrive. And we're going to talk about exercise the pelvic floor as a part of the thrive and reset post-treatment for anal cancer. So again, thank you for letting me be here. Disclosures, I do not have any disclosures, and I'm going to recommend a couple of products, and they are not endorsed by the Anal Cancer Foundation. They're just little personal recommendations. Okay, so as you all know, going through chemoradiation for anal cancer treatment is a rigorous regimen that leaves us often feeling just like less than our best on the other side. We're often dealing with some side effects that can come up in the immediate and like kind of during treatment, shorter term. And then there's some longer term stuff that we can be dealing with too. And if we can just kind of lightly address it as it's coming and then really kind of give ourselves some regular attention in the longer term, all of these things can be improved upon. So common side effects during and immediately after treatment, of course, are radiation burn, so open sores, pain, joint stiffness, fatigue, sexual dysfunction, urinary issues, so frequency, urgency, leaking, bowel issues, same thing, frequency, urgency, leaking. So those can all kind of crop up during the treatment and immediately thereafter. And then longer term, a lot of those things are going to carry over. Of course, like the burns and sores will heal, but we still may be left with pain, overall hip, pelvic joint stiffness or decreased mobility, fatigue, sexual dysfunction. So that might be low desire, that might be pain with penetration, that may be difficulty achieving or maintaining an erection or difficulty achieving an orgasm. With the pain with penetration, that's sometimes from like a vaginal stenosis or narrowing. And we can also get that in the anal rectal canal. So a stenosis or narrowing can occur, and that can really like bother the pelvic floor in general and those canals in general. We can be still dealing with urinary dysfunction. So again, frequency, urgency, or leaking. Urgency meaning the urge is urgent, and sometimes we can't make it on time, or it often might feel like we're not going to make it on time, and we may or may not leak. Frequency more than once every 2 hours. Same thing with bowels, frequency, urgency, leaking. Bowel frequency is different for everybody. In some people, it's after every meal. In others, it's like once a day or once every 2 days. If it feels too frequent to you, especially if you're going like more than 3 times a day, that often is like a sign that it's a little bit too frequent. Urgency is the same thing. It feels like it's difficult to make it on time, or maybe we don't make it on time. And leaking in general, that could be passive, that could be with urge, that could be with stress. So like standing up from a chair, something like that. So let me go to the next slide here. So in the early days, during and immediately post-treatment, we want to get the lymph system moving. The lymph system is a series of vessels all over our body, just under our skin. So if I were to press on my skin and just slide it around, I'm activating the lymph system here. Now, if I were to press harder, I would be squeezing the lymph vessels, squishing right past them and going into the muscle. So we have to stay really light, actually. And we can do this with dry brushing. So I was going to show you guys a dry brush. This is just a little small one. And you can literally just brush the skin. And our big lymph centers are going to be like behind the ears, under the neck, armpits, groin. And then our major lymph center is called the cisterna-chyli, and it's right here in like behind the sternum. So we're going to try to move everything that way. So we can do that with dry brushing. We can also just do it with our hands. So manual lymph drainage is just literally sliding the skin towards those lymph drainage points. And we want to do that daily. And then diaphragmatic breathing as well is something that can really move our cisterna-chyli and get the lymph flowing. And so we want to do that for like 2 to 5 minutes a day. Just set a timer and just big inhale and long exhale. I like to do it with the SH as I exhale. And then just some light pelvic mobility we can do as long as it feels okay. We can do gentle knees to chest. We can do gentle spine twists where we're moving our legs over to one side or the other. We can do a gentle child's pose. So these are all things that we can do every day throughout the day to just sort of give our body that love and attention that it needs in this time. So as we move into like the longer term, we have healed maybe from some of the radiation immediate damage that has occurred and we're ready to kind of go into the next phase of healing, a lot of the same things. We're going to want to continue with lymphatic mobilization. So that's either with the dry brush, which you can get these like at health food stores or of course online, or manual lymphatic drainage and or breath work. Same as I just said in the last slide. We can also begin to add some guided core rehab. So this can be done with a physical therapist or at home. And, you know, one little tip to think about is like in your daily life, before transitional movements, we want to kind of practice engaging the core on the exhale with a SH shh, bringing the belly button into your spine. Before we do these transitional movements, they would be like sitting, standing, bending, lifting, twisting, and reaching. So before I'm going to stand up out of this chair, I would shh, and then I would stand up. And because the pelvic floor has been injured in this treatment, and so the pelvic floor is a huge part of the core. So we want to rehab that core so that it is working and functioning properly and optimally. Pelvic mobility, we can still do what we were doing in the last slide in the shorter term kind of side effect management. So knees to chest, spinal twist, child's pose, and we can start to progress to a deep squat. So that's going to be like, it's going to be a stretch. Think about how like a baby would come down to meet the ground. They're getting full hip flexion, full ankle dorsiflexion, full knee flexion. So I like to hang on to like two doorknobs like this, and I just take myself down. And then I'm like stable on my feet, and I'm like kind of holding myself, allowing myself to fall into the amount of hip flexion that works for me on that day. And that's going to be different for everybody. And it's going to be different day to day. And you can sort of practice being there for up to or more than 5 minutes a day, and just breathing there. And that's going to be huge for our pelvic fascia. We want to really start to move the pelvic fascia through its full range of motion. And, you know, the way we just go about sitting these days in chairs, cars, stuff like that, we're really stopping the pelvic fascia at like 90 degrees. So if we can get that full movement, range of motion, it's really helpful. And then one other thing I wanted to show everybody is this mat that I've been using with a lot of clients. It's called an ajna mat. I'm not even sure if I'm saying it right. It's really popular in like yogi circles. And it's basically like little pokey, kind of like a bed of nails. I have found this to be awesome for just general fascial perfusion of blood and oxygen. So you can lie on it, like on the back part of your low back, sacrum, or on your glutes, or even on your abdomen to really start to perfuse that area with blood flow. And that can really help with the healing. And so of course you can buy those online, and you just search AJNA mat is how you could find it. So that's just something that I've recently sort of brought into my practice and I find really helpful. If you are looking for a pelvic floor PT in your area, a couple great directories, websites would be pelvicrehab.com. You can search by zip code there, and pelvicpain.org. That's the International Pelvic Pain Society's directory. And you can also search by like location there too. So thank you so much again. I've been just honored to be here. And if you have any questions, I'll look forward to hearing from anybody in the live conference. Thanks so much.